Hey there! Welcome to the What's Your Thing podcast, where we're all about great conversations with interesting people.
That's right. I'm Brennan.
And I'm Caitlin.
There's something awesome about every person, a thing that makes them truly unique.
We want to know what it is about everyone, so we're asking,
What's your thing? Welcome to the third installment of the What's Your Thing podcast. I'm one half of your host, Brennan.
And I'm Caitlin. Thank you so much for coming back, episode 3. The last 2 ones were media focused. We're super excited to switch it up. We're going to go into the science fields today.
Very, very, very honored to have a pretty prestigious guest, I would say. Personal friend, but a pretty amazing, smart, humble, and awesome guy with a unbelievably interesting career. Welcome, Dr. Hogan, Dr. Kevin Hogan, who currently works in Ottawa, Ontario as a medical doctor and specialty in pathology. So I'm not going to pretend to understand the science side of it, and that's why I'm going to jump right into it. Dr. Hogan, what's your thing?
So as Brendan says, I'm a pathologist, more specifically an anatomical pathologist. So just to give a little bit of a background, pathology is the study of disease, and anatomical pathologists look at tissue from patients, so either biopsies or resections, and we analyze the tissue and we sign out reports saying is something benign versus malignant, and if it's a malignant or a cancerous tumor, we classify that tumor. So there are actually many different subtypes of different tumors across the body. So that's basically or mainly what I do.
Is the tumor specific to more like cancer in your field, or is there? I don't know much about disease.
Yeah, so every field is a little bit different. My focus is mainly in genitourinary pathology and gynecologic. So in these areas, most of what we do is related to tumors. So tumors can be benign or malignant, and our main focus is focusing on the malignant tumors. But we sign out lots of benign things as well. But that's what we're most interested in. In other areas of pathology, there's always cancer that we're looking at, but there's also inflammatory conditions like inflammatory bowel disease and gastrointestinal pathology, and there's a lot of inflammatory diseases in skin as well, for example.
So is this something, would you work in a lab or do you work in a hospital that has a lab, or how would that work?
Yeah, so pathologists can work in either. So in some jurisdictions there are private labs. We work in Canada, at least. We mostly work in hospitals. So we're connected to the lab. So if you can imagine, there's a lab where a lot of the processing gets done, and we end up with slides that are sent to our office, and we use our microscopes to look at the slides, prepare reports, and we call it signing out or finalizing the report, which is sent back to clinicians for to help them and manage their patients.
It's pretty. That's pretty overwhelming, I would imagine, as a career. Like, I know I find it interesting. What led you to finding your way into this? I imagine, is it one of those situations where you were just a kid and you said, maybe one day I'll be a doctor, or is it something you always chased and then you fell into this kind of specialty?
Yeah, so I guess it depends on what step you want to sort of go into. But growing up, I always enjoyed, the sciences and math, and I went into university into science, not sort of convinced or knowing that 100% sure I wanted to be a doctor, but I, eventually did the prerequisite courses and I developed an interest and I went to med school. And then in med school, in our first 2 years, it's a lot of classroom-based learning, and I always enjoyed the histology lectures, which is basically the microscopy, looking at the tissues that way. That's mostly what I do now. But it wasn't until our third and fourth years where you get a chance to go out and experience the different specialties yourself. So how I got to pathology was actually during other rotations. I remember during a surgical rotation where I was asked to attend a frozen section, which is it's essentially an intraoperative consultation. So there's usually a specific question the surgeon has for the pathologist. Often the question is this a benign tumor or malignant tumor, or did we get the tumor completely out, for example? So this is just a quick sort of preliminary report that we respond back or we give back to the surgeon, and that'll dictate the rest of their surgery. So during that opportunity, I had to experience what a pathologist does some of the time, and to me, it was very interesting. I also had opportunities to follow up on specimens for patients because it would be impacting their current management in the hospital. And I had another opportunity to go to a pathologist's office and see more of what they do. From there, I was able to schedule my electives in our fourth year, where I had opportunities to visit different pathology departments across Ontario, and that's where I've sort of came to the realization that that's what I wanted to do.
So that's what I was going to ask you about part of your journey. Like your third and fourth year, it sounds like it's pretty intense for medicine. This is med school.
Yes, yeah, exactly.
And so it's really practiced. Like you're in the field, you're doing a lot, and then I guess you're following up. So you went across Ontario. Is Ottawa one of the biggest hospital systems in the province? Like, or like I would say it's one of the biggest.
Yes, for sure. It's because we cover a large region in Ottawa. So, we're covering all the way from, I'm probably going to forget I don't know the geographic specifically, but we go all the way to Renfrew, and we go to Hawkesbury, we go to Winchester. So we cover a large area.
So it's like the Eastern Ontario region almost.
Yeah,
really.
Exactly. That's what it's called. It's actually called ERLA, Eastern Ontario Regional Lab Association.
Okay. So then you graduate. What happens after you graduate med school? You finish there, because I'm I don't really know myself. So you've done your third and your fourth year, and then you go on. Is that where you do residency, or is that part of it?
Yeah. So you apply for residency in your fourth year, and you get accepted to a program, and depending what it is. So family medicine is a 2-year specialty, and pretty much everything else is a 5-year specialty, including pathology. So you basically spend 5 years, and you work on the skills that you learned in medical school, and you learn beyond that.
So, alma maters. Where'd you come from? What are your schools?
So, University of Ottawa. I went there for my undergrad and med school, and residency as well.
Okay.
Yeah, I went away 1 year to Cleveland for a fellowship, so that's after the residency training. So that's my only experience outside of Ottawa.
So with going away to Cleveland, is there? Obviously people talk all the time about the differences between Canadian and American healthcare, but like from your perspective in your field, is it pretty much the same sort of thing, like day to day, day in and day out?
Yeah, it is exactly. Yeah, the organization of the residency program is a little bit different in the U.S., but it's mostly the same. Yeah.
Did you become a Browns fan?
Yes. Yeah.
I feel like I would have to.
It's
really went to the States. Never been to a football game, but I feel like the first stadium I'm going to be a fan.
Yeah, for sure. Yeah, it's I can understand the pain those fans have gone through in the last 25 years or so.
That's pretty cool. So you came back to Ottawa, and now you've kind of fallen into your trade. It's your career path. What's the biggest challenge right now that you're facing with pathology? Is it anything like we're talking?
Is it research grants, funding, staffing?
So I think funding is probably one of the biggest things, because the field is continue to evolve. Where we're using more sophisticated testing, which costs more money, and the quote unquote gold standard is moving where it requires more of this testing. So funding is definitely going to be an issue going into the future. Staffing as well, like in terms of a pathology department, it's not just pathologists, but there's pathology assistants, there's medical laboratory technicians, where I think there is a big shortage, especially in those two areas where we need people.
Can I ask, just in your opinion, how does the shortage fall into place? Is that lack of people qualifying, or is it just like people genuinely not interested in that career path, or is it just really hard to get into?
I'm not 100% sure. I think it's not a traditional career path that most people think about. I think that's got to be a big. What's that, sir?
I imagine the threshold to qualify would be pretty high in any of those kind of.
Yes, and for the pathology assistant program, I believe there's only 1 or 2 in the country for the formal training, so that's probably an issue. But I think it's like a lot of things, it's just exposure. If people are not aware of these fields, they're not going to be going into them. But I think they're definitely interesting fields for people to become aware of.
So, you've been doing this for a while now. So, what kind of changes have you noticed in the last 20 years with tech? How has that changed your field?
So the biggest thing that we're sort of facing now is the transition to what's called digital pathology. So earlier I mentioned that a lot of the time we're looking at slides under the microscope, but now some centers have already moved to it, but we're sort of planning to move to it shortly. Is this transition to what's called digital pathology? So essentially the microscopic slides are scanned and they're uploaded to a computer, and that's the way we would interact with the slides and sign out reports. Where some institutions, they actually don't use microscopes really anymore. It's all on the computer. And with that, it ties into artificial intelligence too. So that's going to be something going forward, which will be have a big impact for us for sure.
Are you looking forward to that as like being a net positive, or is there anything that you think could be? Is there any like false positives that can come out of that? I just hear with
Well, that's the
stuff
concern.
like
So to cover sort of the concept of AI in pathology, there's been some sort of concerns that pathologists will be replaced by computers. And a friend of mine even brought to my attention this famous Silicon Valley investor was discussing this on another podcast. And he says that they're working on systems like end-to-end systems that will basically replace the need for pathologists. But talking to people who are actually in the industry, they're saying that that would actually be very unlikely. AI in pathology would be used to help pathologists make them more efficient and cover more of the mundane tasks. Because what we have seen sort of in the early results from it is that the computer could make a mistake, and that would have potentially disastrous outcomes for patients.
Do you think that AI could help you screen faster, and could that translate into people catching things earlier?
I think it would make our work more efficient for sure. There's some stuff in terms of measuring things, like sometimes we have to count the number of cells that are expressing that are proliferating, and that's used just by simply counting the cells, versus the computer would be able to do that in a much more efficient manner. In
Right.
terms of picking things up earlier, I don't think it would have such an impact. That's more dependent on getting the tissue that we need to examine, basically.
I don't know about AI. I just look at it. You've even had conversations with me where you've helped me in the past. I don't think AI. I've tried to talk to my Google a few times, and it just doesn't really have a personality.
Yeah.
I don't
Yeah,
think
yeah,
you can rely on
yeah,
an AI language model being like, "This is really bad news."
yeah. I'm sure they're working on it, though. I'm sure they're.
Lay it on me lightly. At least you could probably
Yeah,
pick the accent, or like, it's like, oh, this is a cool Australian pathologist.
yeah, yeah, yeah,
Your bedside
yeah,
manner.
yeah. Exactly.
So,
Yeah.
so with that, is that changing your perspective? Like the advancements in technology, or is kind of your bread and butter of your industry still kind of saying the same? As you said, you still have to get the samples, you still have to look at it.
Yeah, I think it's just going to improve. It will be more efficient with it. There are just some of these mundane tasks will be replaced by AI, with digital pathology, and it'll in terms of digital pathology, it will also make looking at older cases a lot easier, because you can imagine they're all on slides. So if we want to review the actual microscopic slides, we have to go to a storage
Yeah.
facility sometimes. Whereas if it's all digital, we could quickly pull it up on our computers. It makes sharing cases a lot easier too. So you might want to share it with someone at another hospital. So that's something we also do a lot, is share difficult cases and get second opinions. So it would make things like that much easier as well.
Yeah, I guess that, yeah, it could only help your networking. And then you're not
Yeah, for
risking, I
sure.
guess, if it's all digital, it's in a cloud, only certain people have access to that information.
Yeah,
There's a lot of risk in sending something like carrier. I mean, I'm not putting
yeah,
down the mail system, but or it gets lost.
yeah. That
It's like,
happens. That
you
that
upload it to the
happens for
cloud, you
sure.
all use the same software. It's like, I need to see this X, Y, and Z on here. Hey, tell me what you think. So yeah,
Yeah,
I could see it as being a net positive for your career.
yeah.
So do you have any predictions with that for the future? Like
Or just in general for your field?
yeah, like
Yeah, so I think it's a combination of that in the future, and also using more of the sophisticated testing. We call it molecular testing. So that
Can you explain
we
that?
right now, yeah, we right now mostly classify tumors, like, and give what's called a specific subtype of a type of cancer. So this will go further than that. So that's based on what's called morphology, or what we're seeing underneath the microscope, what the cells look like. So what the molecular testing is doing is looking for specific genetic changes in the tumor cells. So something we can't see by microscopy, and that will help in terms of the patient's management, in terms of what treatment they will get. So they can have tailored treatment for their specific genetic mutations in the
That's
cancer.
massive.
So yeah.
And so is this one of those things that's like long term, kind of like hypothetically it's going to be there, or is this something that you see like ever evolving? It's like slowly
Yeah,
coming in.
yeah, it's coming in for sure. In the last few years, we're doing more and more molecular testing on all sorts of different tumor types.
And yeah, that's pretty sweet.
Yeah.
That with the advancement, like knowledge sharing, and it's only going to open your communications and your dialogue with other people. It's networking. It can only be good
Yeah,
for patient advocacy for you guys,
for sure.
expanding your knowledge.
Yeah.
So this is where I guess I want to ask the doctor and you, is there anything that you feel like, any messages that you need to get out there to people with respect to your trade, with what you do, kind of like, people need to pay more attention to this. This is an opportunity to kind of share your experience or your knowledge.
Yeah. So I think one of the biggest things would be to take different types of cancer screening very seriously, because a lot of these screening tests are very valuable in catching either the either a tumor at a pre-malignant state or a pre-cancerous state, or just catching it earlier in the disease process. So we'll have a much better so the management will have a much better outcome for the patients. Like, for example, colorectal screening, where you have a simple test looking for blood in the stool, could maybe help us find uh, something called a polyp or an adenoma before it changes, it mutates, and develops into a cancer. And similar things for cervical cancer screening as well, and many other types.
So with that, kind of for patient advocacy, if there's people who are stuck out there, let's say they don't have a doctor, that's just a situation where there's a lot of people who don't have a family practice. I feel like that could be a situation where they don't kind of advocate for themselves. They see something wrong and they're like, oh, maybe I'll just put it off. And there's a lot of people who are just like, I can be one of them, where I look at something and I'm like, oh, am I being a hypochondriac? Like,
Right.
you
Yeah,
talk to me. Am I thinking something of nothing? Or it's like, holy crap, this might actually be something, but am I too subconsciously afraid I'm not going to do anything on it? Is there anything
yeah.
to that you would say, like, maybe in these circumstances, trust your gut, go with it, maybe go to a walk-in if you have to?
Oh, for sure. Yeah, a lot of people experience these symptoms or differently. Some may go into complete denial and let something progress and just get worse and worse, or they don't have access to a clinic like you've mentioned. But yeah, if I were a patient, I would use all possible avenues to get you know the treatment and someone to look at it as best I could.
So that's a big if to our listeners. If you
Yeah,
think something's wrong, err on the side of caution, get it looked at.
yeah, yeah. And as a genitourinary pathologist, one of the things we look at is bladder cancer. So, example, a simple thing: if you see blood in your urine and you're over a certain age, I believe it's 40, it's a worrisome sign where you should get that evaluated.
That's
So, talking about patient advocacy, for people that don't have doctors that need to advocate for themselves, if they have something like that, would it be something? What could they do if we're in a system with a doctor shortage to make sure that their samples get to you? Do you have any tips or tricks for that?
Yeah. So whether or not you have a family doc or not, so basically you always have to find a way to be seen. So it could be a walk-in clinic, or at the most extreme end, it could be emergency. But if it's something worrisome enough, definitely go to emergency. They need to be seen. In terms of requesting a biopsy, that's usually a conversation that the patient will have with that care provider, and it's usually they will have input. And if there is a big concern, and if patients push for it, then the care provider could provide that service of getting a biopsy and then sending it to pathology
Right.
if they believe it's worrisome.
And I think most doctors are pretty good for that.
Yeah, exactly.
Like
Yeah,
they're not in the business of not helping you. So that's,
exactly. Yeah,
and like,
yeah,
Yeah.
reiterate your message. Get it. If you think something's
yeah,
wrong, get it looked at.
And if the
yeah,
doctor says, "Oh, maybe not right now," we have intuition, and if we think something's wrong, we insist, right?
yeah, yeah,
Yeah.
for sure.
Thank you. So I guess this is kind of like, this doesn't have to be on the negative side. Is there anything that you find with specific to your trade that would surprise most people? Like just something interesting about your thing that kind of people wouldn't really know?
Yeah, so I think just how complex the system is, or how complicated the whole process is, of getting the biopsy, and because a lot of people, even some in the healthcare fields, might not really have an idea what goes on in the lab. So the specimen that's sent there goes through many different hands, and different steps, before it's actually, before those slides are received on, a pathologist's desk. So lots of, there's many steps involved, many people involved in the process. Yeah, I think that would be the.
Is it fair to say too? Because I do feel like people do complain because, we're human beings and we complain about everything. Like, just wait it out because there's people doing their best for you at the time. If things are taking time, it's for a reason. Like, trust.
Yeah,
Do you find
yeah,
that, like,
exactly.
maybe
Yeah,
people get that message that, like, nobody's I know you. I've seen how you work, and I can imagine that everybody in your field is the same. Like, nobody's just taking their time with things that are very, very important. And I can only
yeah,
imagine anything to do with a microscope takes a lot of paying attention to detail. A lot of,
yeah, exactly. Yeah, and I think it goes back to all the steps involved. So
can you
before we
explain that
see it,
process for us? Like,
yeah.
sorry to
So
cut you off. Like,
so
let's say
just
I go into the doctor and unfortunately there's some worrying signs. What would be the step A to Z kind of process flow before you get kind of communicated
yeah.
back? This is what you need to do.
So let's just say it's a concerning, say, lesion on your skin. So the the family physician may be comfortable enough to evaluate this themselves, or they might refer you on to a dermatologist. Eventually, if it's concerning enough, they'll take a biopsy. So that biopsy will be put, in something called formalin, which helps, fix the tissue. So these are just terms we use. But so the specimen gets sent to the lab. It gets fixed in formalin, and then it has to be processed. So it has to be gross, meaning that, so biopsies are straightforward, meaning that they'll be put in these cassettes and then sent on for a step called embedding, where the tissue is fixed in wax. And then after that, or it's been put in wax, and then eventually they're called blocks. Eventually, these blocks will be cut, and then a very thin slice is put onto a microscopic slide. It's stained with, what's called hematoxylin and eosin, and then the slide is eventually sent to us, pathologists. Sometimes we have to do further testing on the specific tissue, in something called immunohistochemistry, or special stains that will give us more information about the particular sample. So that's why these things can take some time, is that each of these steps can take a day or two, So
That's what I was going to say. I'm impressed that could
yeah,
even be a day or two. I imagine, like, the
yeah,
higher risk the case, the faster it's going to be.
yeah, yeah.
I-
We do something called rush specimen. So we try to go through these steps as quick as possible. And in those cases, the slides could reach the pathologist's desk in about 1 or 2 days, but that would be the absolute fastest.
okay, yeah, that's
Yeah,
fair to say. It sounds like there's a lot involved, and I can only
yeah,
imagine that there's. I mean, Ottawa, yeah, it's a big, big region, this Eastern Ontario area, but there can only be so many pathologists, right? And, like, people live their
yeah.
lives, they have their vacations, they have their time off. It's probably, I can imagine, a very stressful job. Um,
Oh yeah, it can be. It can be. It's yeah, depending on the situation. Yeah, for sure.
so would you say, like, yeah, that would be the message? If you kind of, if you're worried, get it checked. But also, I want to advocate for you and your peers. They're working their butts off. Be patient. Like, there's,
Yeah.
Yeah.
Oh, for sure. Yeah.
I know myself. Fortunately, not yet having to do anything like that, but I have a lot of respect for people who go through that sort of thing, because I would just be beside myself, kind of thinking constantly, worrying,
Anxiety.
anxiety through,
Yes. Yeah. For sure.
and
Yeah.
it's that can turn seconds into hours.
Yeah.
Yeah.
So, do you have anything that you want people to know? I know you had mentioned to me that you have a really cool resource that you were gonna. Is there anything about your trade in general that you want people to know, and then any resources that you want to plug that you can make available, or how we can make available to people to kind of help them.
Yeah, I think I've already covered it, but just yeah, it's definitely an interesting process in terms of how, you know, the from when a biopsy is taken until when a final report is made. So that's definitely a very interesting, complicated process. It's not just a simple, some sort of machine that just sort of analyzes the tissue. There are many steps involved. But in terms of resources for patients and their families, a colleague of mine has developed a website that helps explain some of these more technical terms that you might see on a pathology report. It's been used, in Canada, but it's also there's been hits from all over the world in terms of its use.
Do you have the website name?
Yeah, it's mypathologyreport.ca.
That's pretty cool.
So yeah, so it should be pretty straightforward because nowadays patients can often access their pathology reports before they meet with their care providers. So you could imagine there could be a lot of anxiety over a lot of these complicated terms where patients just don't quite understand what's being written. So it could help them sort of break down the report and understand these terms a little bit better.
We're going to post that to all of our socials, and we want to make sure that people have that resource. And that's another thing I'd like to say. It's pretty cool. I find people in the medical field, they're either you see them at your worst where you're most terrified, or you kind of don't see them when you're getting treated, and then you might talk to them as you're leaving, but you're not thanked enough. And especially just if that's just on their own time, your colleague going out of their way to make this resource available to people is just another example of the kind of character it takes to become someone like yourself, a medical professional, not only that, a specialist.
Yeah.
Really appreciate that work that you do, because I don't think, first of all, I was never good in science, but I don't know if I could sound like it. Can I ask you kind of a different question? Like, in terms of size of samples that you would review, what's the range? Like, do you ever get like really big stuff, or is it mostly microscopic, really, really fine? Or I guess it depends on what you're concerned about.
Yeah, so it's both actually. So we get tiny, they're called core biopsies. So they're probably anywhere from a centimeter to 2.5 centimeters long, and they're about a millimeter in diameter. So that's usually what we're dealing with in terms of core biopsies. But there's all different types of biopsies. There's shave biopsies. There's even something called cytology. So this is what's used in cervical cancer screening, where they're actually just getting the epithelial cells themselves and not the underlying tissue. So that's a whole different sort of subspecialty within pathology, but that's where you're only looking at the cellular level rather than sort of the organization of the tissue. And then going from there, we get everything in between to very large specimens. So we get complete organs.
Oh, really?
Yeah, you could even there's a subspecialty called bone and soft tissue. They could even receive complete limbs.
Wow.
So yeah,
So
because there are.
Sorry, this might be a little bit morbid, but like, let's say, do you ever get like, are you always on the front end of we're looking at this pre-diagnosis, or do you ever look at things after maybe somebody has passed, and you're kind of like, do you ever do that kind of research after the fact, saying, or is that more of a?
Yeah, so a lot of our research is done in what's called like historical cases. So it's often not related to the patient's immediate management, but there might be just something interesting about that tumor, and we may look into the medical record to see how they have fared since. So we may look at a specimen that's 5 years old and for a patient with a particular type of cancer, and we may evaluate how they have done. So that some may have passed away, but some may be alive without disease, or maybe they've had a recurrence of their disease. Some pathologists do autopsies,
Yeah.
which is when the patient obviously has passed, and they're looking for different answers for often the clinicians, or in forensic pathology for potential crime investigation.
Oh, wow.
Yeah, that's
Yeah,
wild.
That's interesting.
yeah.
I guess I was going to ask, kind of as a person who doesn't know much about this, is there anything you can say to people is to maybe look out for genetically? Are you predisposed to certain things if you have a family history in terms of like specific types of cancers or diseases that you should maybe if you're aware of it in your family, you should look out for it.
And I guess that's very broad, but you mentioned that that you're pathologist for very specific things. So within your working frame.
Yeah, I think the best way to look at it is if you've had a family member who is relatively young, or if you've had multiple family members with the same sort of cancer, or cancers belonging to a specific family, where these cancers are sort of related to each other, or tumors that you often get in certain conditions. So that would be my biggest recommendation. But when your family members are going through the different treatments or experiences with their caregivers, they often are able to. The caregivers are often able to suggest different things into looking into these concerns.
Okay.
And interestingly, with our molecular testing that we're doing, we're often looking for genetic changes that might be in your germline, what are called germline mutations. So sometimes we identify mutations that are often passed down to the patient's children.
That could be like wild
Yeah.
for future research, eh?
Yeah.
Yeah. Oh, for sure. Yeah.
Life-changing.
That's insane.
Yeah.
So I guess this is the fun part of the podcast.
Mhm.
We've asked you all about your thing, your profession. Is there anything you wanted to share with us that maybe is not your thing? People might not know about you, or anything that stands out.
Yeah.
You're a pretty busy guy.
Yeah, I don't think it's anything too interesting. But as you know, I play hockey. I'm actually on Brennan's hockey team that he organizes every year.
Yeah, Kevin's the big guy who's the defenseman that stands in front of our net to make sure the puck doesn't go in, and then I'm the big guy who stands in front of their net that tries to bounce pucks off of my.
Yeah. So that's a lot of fun. Tied into that, like spending time with friends and family, and some of them are on the hockey team. But I like watching sports.
You know you're a Blue Jays fan.
Yeah, Blue Jays fan. Yeah, unfortunately, they're not looking too good right now. But what can you do?
Well, thank you very much for taking the time for us tonight, because I know it's a big game.
Yeah.
I kind of pulled the shoot on that one, but
we appreciate stepping away from the playoff.
Yeah.
Well, no, we appreciate you coming on. This was a pretty cool experience for us, but I think it sends a lot of good information to anyone who's listening to us, especially. I think it's no secret that your career can, especially what you do, can have a massive, massive, massive impact on people's lives. So
So thank you for explaining how you do it. And
hopefully it was clear enough for you guys, or at least
absolutely
it gives you a starting point to look further into these issues.
And one more time, just your friend's website for those.
Yeah, it's mypathologyreport.ca.
So My Pathology Report, it will walk you through some of the more complicated terms. After you've received it, you might receive it before your doctor. So definitely use that resource. Thank you to your colleague who came up with stuff like that, and to all the other doctors and healthcare professionals that are working their butts off to make sure that we're all living our best lives. So
thank you.
Thank you, Dr. Hogan. We appreciate you being on the podcast.
You're welcome. It was a fun experience, and I hope all the best to you guys.
Yeah. We'll see you on the ice.
Sounds good.
Cheers. That was our third episode of the What's Your Thing podcast. Thank you, everybody, for watching and listening. And a special shout out to one of the people who makes our podcast great, Miss Carolina Krim, who is working for us all the time to make this podcast as awesome as it is. And she's got one herself, the feature-length podcast. I recommend you check it out if you're into movies and television and all that. They got a pretty cool thing going on. So thank you, Dr. Hogan, for being here, and all the best. We'll see you next time on What's Your Thing. So make sure to check us out, what'syourthingpod.com. Check us out on Instagram, YouTube, follow us on TikTok. Check us out. We're going to have a blast. What's your thing?
What's your pain?